KTN News, Nairobi.
Now, still on health matters, staff shortage and lack of consistent supply of lab reagents are among issues hindering the country's testing capacity for COVID-19. In a meeting chaired by the Senate Health Committee earlier today, with various stakeholders within the health sector present, Kisii Governor James Ongwae said that counties are currently overwhelmed, with some being forced to pay their medical personnel using bank loans. Our reporter, Saada Hassan, tells us more.
We have a relative shortage of technical and scientific staff, and we actually are looking forward to being allowed to hire more staff to fill this gap.
The current testing capacity of Kemri, one of the largest testing centers for COVID-19, stands at 4,000 per day, which is way below the expected 10,000. According to Professor Kombe, lack of the required reagents have scaled down the number of tests.
Mr. Chair, because of the erratic supplies of laboratory consumables and PPEs, this sometimes is not achievable. At the moment, I can say for sure, we actually are able to test up to 4,700 or undertake up to 4,700 tests per day in all our laboratories around the country.
Stakeholders appearing before the Senate Health Committee were put to task to explain the status of counties in managing COVID-19. According to Kisii Governor James Ongwae, counties face a huge challenge in paying its personnel due to delays from the national government in releasing the needed funds.
How do you recruit personnel if the few that you have, you are actually paying them through a bank loan?
As a way forward, the Kenya Medical Laboratory Technicians and Technologists Board has proposed the use of technology in reducing the burden that Kenyans go through to seek healthcare.
Telepathology in particular is the ability to practice pathology at a distance, and we're able to use images and testing to do consultation and oversee all laboratories within countries. It is currently ongoing worldwide.
Meanwhile, 780 new COVID-19 infections have been recorded in the last 24 hours out of a sample size of 6,158. This brings to a total 80,102 COVID-19 infections. 552 people have recovered, with 468 from home-based care program and 84 from various hospitals. This brings to a total 53,526 recoveries. Sadly, 10 more people have succumbed to the virus, raising the number of deaths to 1,427. Saada Hassan, KTN News.
And that's the latest in terms of the health outlook.